Good evening, Dr. Beth Fisher. How are you tonight?
Good evening, Pierre. Good evening, Cardiff University. Hi, everybody there. How are you?
Well, I'm hoping they'll answer yes or we're well. Um, as you know, we've recorded this a few days back. Thank you ever so much for agreeing to talk to us. Um, Everyone's always keen to know how did you end up starting up Senior Medical Cannabis?
Oh, that's an interesting question. I'm a former professor for students, children with disabilities. I'm very interested in the area of health. How I started Senior Medical Cannabis is I'm very concerned that as I was getting older and my parents were getting older, that there wasn't an opportunity to convey information or supports for seniors regarding medical cannabis. And because of this, I knew that that in 30 years, I might not have the choices if I didn't do it now, if I didn't provide seniors with an information base, and that's what Senior Medical Cannabis does. We are information based for medical, legislative, social, and media purposes for seniors.
And was there any personal reason for you doing this?
Absolutely. Friends at the presentation, friends, I'm going to call you my friends because we all have someone, a loved one who could benefit from cannabis. But friends, my mother had ALZ or Alzheimer's. It was a very dramatic decline. It started about 2000 and 2000. She lost the love of her life. It was a downward cycle. The next major health event for her was in 2002, where she had to have back surgery. Still having a little confusion, she went through the back surgery. During that time, they gave her opiates for pain, Pierre. That's what they did. As a result, she began very constipated. Once she was out of surgery and in the assistive rehabilitation setting, she wasn't moving any of her bowels. There was nothing going on. She was being impacted, and literally I helped the nurse clean her out. That requires gloves and ointment, and we tried everything. We tried suppositories, we tried everything, but in the end, I helped the nurse actually reach in and remove the feces. That was very painful for my mother. It was very painful to do that for her, knowing that she needed it. And also, I could hear my aunt on the other side of the room saying, "Why won't you open the door?" To which, you were helping someone. The reason is, it's true to my heart, is that I want better for my mother than she had. And now that we know about medical cannabis, Pierre, I want better for me. I don't want to be in that high risk factor. I won't be in that high risk factor. With cannabis helps to insulate and prevent the protein, or we call it plaque, from building in the brain. Doing everything I can, from mental exercises to meditation to yoga, and using cannabis as the medical option I have to stay healthy, to continue my anti-aging life. I'm 58, Pierre, and folks, take a look. I do yoga about an hour and a half every day. I grow. I teach seniors and growers how to grow better. But I'm close to 60, and I never know. No.
You'd never tell.
So that's why we did. I did it because I wanted to make sure I had the best medicine possible. And those at Cardiff University this weekend know that cannabis works. Cannabis builds your cannabinoid system so that you're sufficient. You don't have a deficiency. You are healthy. And because you're healthy, your cells want to be the best they can be. It is anti-aging. It is a wonderful, wonderful, wonderful medicine. You can grow it. You can grow it anywhere. Grow it with your mint. When it's legal, grow it with your mint. Grow it with your lavender and chamomile.
Yeah. And one of the things that you must get asked all the time, what's the question most asked?
Oh, question is, do I have to smoke it? They have, seniors around the world have this idea that you have to smoke it. Now, smoking cannabis is a very ancient way of administering medicine. a very ancient way, and it's wonderful. I'm not discounting that, but there's vaporizers that will not hurt your lungs, not hurt your mouth. Remember, gums and gum surgeries, the smoke is hard. So when a senior would say, do I have to smoke? I'd say no. You can use a topical. There's high CDBs, even made from hemp right now, that can alleviate the reduction of swelling, and you'll feel better. You can drink it, you can wear it, you can bathe in it. There's Epsom salts that you can have that are cannabis infused. So if you're tired and achy, especially for those who have lupus, and you never know when the wolf is going to hit, then you can soak in the cannabis and you can feel better.
Wow. And you mentioned earlier about teaching them to grow. Is that part of your gardening?
Yes. I want a T-shirt, everybody. If someone's a printer, I want one that says, "Let my seniors grow." Think about it, seniors. This is so important. What we find, Pierre, and those at the presentation, no, seniors don't want to grow 150 plants. They really don't. They want to grow their own medicine for themselves or for someone that they love. You're not going to see all these plants. They want to grow 5, 6, maybe at the most. They might be on holiday for 4 months somewhere else, so they want to make sure that they have their medicine at the time. They don't grow constantly. They don't grow year-round, and they don't grow 150. There's one sweet little lady in Northern California who grows it, like I said, with intermint and lavender, just like the Moroccans do. She loves it. She'll point it out. She'll take pictures. It's great. But then she takes this medicine, this true medicine that she selected for herself, micro strains for herself, depending on her need, and for her friends, and she grows it. And then with it, she'll either provide the flowers for smoking or vaping, or taking it and turning it into a concentrated oil that she made, knowing that she used organic products, that she took care of it with love, that when that first little flower came out, she cheered and sent everybody a Facebook alert on it. Spring is in the air, and seniors want to grow. Folks, you grow your own medicine. Your prices, you won't need as many pharmaceuticals. This means that you will have more income once you're up and growing. Now, growing is going to take a little investment, but not a huge one. But once this comes through, you have your plants, you have your medicine. You will not have to go, as we do in the U.S., go to dispensaries, and you will not have to go to the pharmaceutical. And I will not say their name unless you want me to, but I'm a horde. I watched Weeds 1 and 2 and 3 last night, and we watched that major pharmaceutical location in England. We watched that he took ownership of it. No, it's a plant. I don't own it. No one owns it. It's a plant in the ground. Just grow it. It's a weed. It's full spectrum. As a plant, it's full spectrum, which means you get everything that nature intended for you to receive. That's better than someone taking it and extracting the THC and only giving you one part of that. All of the CBDs, CBGs, THCs, THCAs, it's in something called the entourage effect. You're getting the whole thing.
Yeah.
Now, folks, when I'm in my garden, I call the entourage effect when my red flowers want to begin imitating my purple flowers. And it comes out beautiful. That's what I call it. But in scientific, the entourage effect is your full spectrum of everything that's within the plant. This is why it is so important for you to grow your own. Because you know what you put in it. You know how you raised it. You know what music you played for it. You know. And you love it. And that shows. It will show.
And it's important that it's lit with sunlight.
Yes.
And grown in the ground. Yeah.
Yes.
Could you please highlight for the audience the obvious summing up of the differences between opiates and cannabis medicine?
Oh yes. Let's first take let's take opiates. Opiates cause confusion, drowsiness, confusion. So you're first going to get kind of, and then you're going to become confused. You're going to walk around, your balance, everything's going to kind of be out. Another indicator is nauseousness. I don't feel so good. Nah, I'm all right. Then you get really upset stomach and you get constipated, which means your body's not moving. It is in a state of a poisonous state. You have to remember, opiates only deal with the perception of pain. They do not address the issue of pain. They only deal with a perception. This you have to be very careful of. Now, let's do to cannabis. Cannabis affects the brain, affects the spinal cord, and any peripheral systems, the nervous system, the digestive system. With cannabis, you reach a status of homeostasis, which means it wants your body to reach optimal health. So what you'll see with issues of pain, cannabis relates, it helps reduce the inflammation, which reduces the pain.
Yeah.
So cannabis does not have, you can't overdose on cannabis, folks. It's not recorded. It's not there. There have been no deaths due to cannabis. Now, there was a study from the National Institute of Drug Health that said between 2004, 2007, there were 1,668 opiate-related deaths due to prescription, not due to on the streets, but due to doctors not being able to prescribe the right amount of medicine at that point.
And opiates.
Yes, and opiates. So these are physician-prescribed related deaths.
Yeah.
And that's just too many for a pill that is dispensed so much.
Yes. Wow. Dr. Beth, I would love to carry on talking with you for the whole evening, but we have to move on, I'm afraid. But it's been absolutely joyous. Is there a last message for everyone here?
Yes. Everyone, please. I'm right here. I want you to look at me. I want you to know, those of you who are students, please take the time. I know that you're fun. I was a university professor. Take the time. There's something called Granny Stormcrow's List. If you contact me, I will send it to you. It is 3 full PDF files of medical research studies, not the complete studies, the citations, and there are 3 PDF files. To those of you who are history majors, begin to explore, look at the history of cannabis. Those of you in science, begin looking at the studies related to it. Those in medicine, know that your patients need you to be compassionate and caring, and look at everything that is there, the medicines that are there. Explore cannabis, try it, find it. For everyone else, please stretch yourself. We are more than just a weed. It is medicine, and it will help us heal the planet and heal ourselves. Thank you so much, Pierre, Sarah, everyone at Cardiff University, Hemp Works UK. I'm so excited to be here. Thank you so much for having me. Everybody take care. If you need me, seniormedicalcannabis@gmail.com. Bring your questions. Come on over. Take care.